Hi, my name is Courtney Curtis, and I'm a nursing student with Indiana State University. Today I wanted to speak to pregnant women, specifically women who will be pregnant or delivering during flu season, about getting their flu shot during their pregnancy. After this presentation today, I want you to be able to determine the safety of the flu shot during your pregnancy, understand the importance of receiving your flu shot during your pregnancy, report how the flu shot can prevent maternal complications, summarize how flu shot can prevent fetal health problems or complications due to the flu, and be able to recognize the ability of the flu shot to protect your baby after they are born. I have two handouts to share with you. One is a pre and post test. It's 10 questions with 4 multiple choice answers. And then I also have a handout for you in the form of a brochure. So these 2 links you can copy and paste. They'll take you directly to those documents through Microsoft SharePoint. This is just a snapshot of the pre and post test. So you'll go ahead and take the pre-test now. And at the end, we'll retake it as the post test, and we'll compare after you've received more information if your answers are the same. This is also a snapshot of the brochure that's at the second link. It just has some quick information about receiving the flu shot during your pregnancy. And it also includes 2 more direct links to 2 articles with even more information. One is from the CDC. The other one is from mothertobaby.org. It's a fact sheet about getting your flu vaccine. Both links should take you directly to those articles. So the flu shot is safe during pregnancy. The CDC does recommend that pregnant women get the flu shot every year, as well as everyone. So they would think it's safe for everyone, regardless of if they are pregnant or not, and they want you to get it every year during flu season. A pregnant woman can receive the flu shot at any point in her pregnancy. It's safe at any point in her pregnancy, and it will be effective at any point, whether she gets it in the first trimester or right before she delivers. And it's important to note that getting the flu is much more dangerous to a pregnant woman than actually getting the flu shot. Any side effects of the flu shot would be temporary and minor compared to any complications or side effects from the actual flu. The only time the CDC does not recommend getting the flu shot is if you are actually allergic to one of the ingredients in the flu shot. There's no special complications or contraindications for pregnant women. They recommend it for everyone. So the flu shot is very important during pregnancy. 3 of the major reasons are that it can prevent the flu, of course, and any maternal complications due to the flu, and it can prevent fetal health problems due to the flu, and it actually can continue to protect the baby after birth. So, more information about how it can prevent flu and maternal complications. So, pregnant women are at risk of getting the flu more so than people who are not pregnant, and they are also not able to fight the flu as easily as someone who is not pregnant. Their immune system is more compromised. They are very sensitive while they're pregnant, and women that are pregnant are not able to take many medications that would help them during flu season if they do catch the flu, due to potential birth defects and other harm that could be caused to the fetus. So if they were to catch the flu, they would kind of just have to ride it out. You would most likely need to go to the hospital, and if you do, they really can only give you fluids for hydration, and they would need to closely monitor the fetus, but there's really not much else they can do due to causing any potential harm to the fetus. And pregnant women, not only are they at a higher risk of getting the flu during flu season, but they are at a higher risk for serious complications, and that includes death from the flu. So just getting your flu shot while you're pregnant can help you completely avoid many of these complications. So the flu shot can also prevent fetal health problems due to the flu. So if the mother does get the flu and the stress it would put on her body, it can increase the risk of a premature labor and delivery if she does get the flu. Premature birth can increase many risk factors for newborns, and newborns are way more susceptible to infection, so we would want to avoid that from getting the flu. And then there's also severe symptoms of the flu, just like a high fever, that can also increase the risk of birth defects. So not only can the flu increase the risk, but many of the specific symptoms are also a major cause for concern for a newborn baby, especially if they are premature. And the flu infections that can be secondary to the flu can also be, very hazardous to the health of an unborn baby. And, you can avoid it simply by getting the flu shot. So the flu shot is actually able to continue to protect the baby after they are born. Not only does the mother who got the flu shot while she was pregnant, not only is she protected from the flu shot and avoiding the flu, but she's able to pass that immunity onto her baby after they are born. Babies are not able to get the flu shot until they are 6 months or older. So those antibodies that the mom is able to pass to the baby can protect them up until that 6 months, until they're able to get the flu shot if the parents feel comfortable if it's flu season and they would need to get it. And not only is it passed through the antibodies in the placenta, but it can also be passed through breast milk if the mom is breastfeeding. So you have a few options, a few ways there that you're able to pass that immunity on to your baby. And that multiple studies have been able to prove not only the safety of the flu vaccine for babies, but the efficacy in protecting them. So not only is it safe for the pregnant woman herself, it is very safe for the baby to be exposed to that flu vaccine. So I want you to go ahead and take your post-test again. And you can compare. This is just another little snapshot of just the first few questions, but it is 10 questions. And you want to retake that and compare your answers, see if you learn new information, or if there was maybe things you didn't know, and you maybe changed your mind. I wanted to also redirect you to these two resources. They were included in your brochure. The first one is from the CDC. There are tons of articles on the CDC website for getting the flu shot in general, as well as while you're pregnant. I included this one because it had a lot of the information that was included in my presentation today. And then mothertobaby.org, same thing, they have a ton of articles, but this one was specifically about getting the seasonal flu vaccine while you are pregnant. And thank you for watching my public service announcement on getting the flu shot while you're pregnant.